So, hello everyone, and welcome to the very first episode of OSCE Talk. My name is Matthew Pettigrew.
And my name is Peter Afferty.
And we are two resident doctors from Northern Ireland who have just graduated from Queen's University in Belfast. We've always been two people who practiced OSCEs together, and we just thought that this podcast would provide some kind of educational resource for people who can listen to hopefully learn something and pick some things up that we picked along our 5 years in medical school.
We came up with the idea of this podcast while we were studying for our finals, and we noticed that there was a real lack of a good audio source of materials, and we just thought this podcast could really benefit you.
Yeah, absolutely. And the other thing I think we noticed is that, initially going into medical school in first year, the OSCEs are terrifying because of just that unknown. And then actually, as you progress throughout medical school, the OSCEs get more and more complicated, and that sort of detail and information and things that you need to know about them actually builds. So I think just coming from two people who've just finished their final year OSCEs, this is sort of the perfect way for us to go from very basic in first year, thinking about basic histories, working our sort of way through, the topics like cardiovascular, respiratory, gastro, things that you'll be asked initially, all the way up to sort of a final year level where things become a bit more complicated. There's counselling, there's challenging scenarios, breaking bad news, and things that take a little bit more technique and a little bit more practice, and actually something that I don't think we had much of an idea of really before we actually did our finals OSCE, and it was something that was quite difficult to practice and there weren't many resources.
On today's episode, we're going to cover how it's best to prepare for these examinations. So my first question for Matthew is, what actually is an OSCE?
Yeah, good question, Peter. So OSCE stands for Objective Structured Clinical Examination. And basically what it is, it's a practical station-based exam where you sort of rotate through clinical tasks, taking a history, examining a patient or explaining results. And you're going to be sort of assessed on a number of things throughout that. You're going to be assessed on your structure, your communication, and actually your clinical reasoning sometimes with questions at the end. And that's why someone who's a really calm, sort of a clear communicator and actually follows that really nice structured approach and sort of goes through almost a checklist in your head will probably often score higher than someone who's a bit more scatterbrained and has more knowledge but just a lack of structure there. So I think one of the things that we want to talk about is just how to approach that format early for your OSCEs.
Yeah, definitely. So learning the format early for your university. With ourselves in first year, stations were always 5 minutes. You usually have 1 minute outside the door to read the brief, and then you have 5 minutes in the station, and this brief will usually say something like, at a first year level, please take a history from this patient who's presented with chest pain.
Yeah. And absolutely. And those should be quite simple and straightforward briefs, especially at those earlier years. One of the other things we want to talk about just quickly to start with is also using the mark schemes. As we were saying, if your medical school gives you mark schemes, you need to use them. That tells you exactly what examiners are looking for. And especially in earlier years, they're often marking straight off the mark schemes. So I know in our university, we had a number of mark schemes that went through basically all the systems that you needed to know for first and actually second year level. And really what they're doing as you go through the years is they're not changing those dramatically, but they're just adding in small things to that just to really maximize your mark. And it's also then just about your slickness at working through them. So the things that might be on the mark schemes really basically like, did you introduce yourself? Did you wash your hands? Then getting sort of into the middle, did you ask the patient, their ideas, their concerns and their expectations? Did you summarize? And you can score really well just by going through those basics.
Yeah, great. Getting to know mark schemes and not forgetting those easy marks is a great start. In terms of practicing for these exams, it's essential that you practice with friends regularly. It's definitely the number one rule for doing well, apart from engaging with real patients on the ward. But really, repetition is key here.
Yeah, absolutely. And the earlier that you start in the year, the better I've tended to do. And certainly in the years that I started very early, October, November time, even though the OSCEs were in May, June or July, I found it much easier just in terms of how slick I was and building muscle memory at that structure, because that is all that OSCEs are, is they're a structured way to show your knowledge. And I'm sure you'll pick up lots of knowledge throughout the year, and it's just how to get that out most effectively.
Yeah, definitely. OSCEs are a verbal exam. They're not meant to be revised alone like your written exams. So practicing out loud is very important.
Even hearing yourself speak and things can just make yourself feel a lot more confident. And I think there's certain phrases and things that we'll discuss certainly in the next few podcast episodes, just to try and highlight how important it is that of wording and how important that is in terms of getting marks. Even the way you ask your ideas, your concerns, your expectations, things like that. It's all very important.
So guys, thanks for listening to the first episode of OSCE Talk. This has just been a quick overview of what we aim to do and how to best prepare for these examinations. Our next episode is going to be just jumping straight into the basics of how to take a good history. Again, this one will mostly be aimed at our first year colleagues, but it'll be a good refresher for everyone.
Yeah, absolutely. Thanks for listening. And as always, good luck in your revision.